Abu Inusa of the League of Youth has petitioned Shraj, hoping the issue would be investigated.
That is the case that we are pursuing. So we are pursuing Shraj to investigate that case so that those who are found culpable can be dealt with according to the law.
What exactly are you asking Shraj to look at?
What we are asking them to do is, it was on the part of them, it was a negligence on the part of the doctors, because the case was brought there around 8 o'clock p.m. and only the blood to be given to the girl around 10 a.m. the following day. So it was negligence on the part of the doctors.
So this blood, the patient's father delayed in getting the blood to the doctors, or?
No, it was the doctors, because they asked them to pay and they have paid the money. So they were waiting for them to bring the blood from the blood bank and infuse it to the lady.
Such deaths from perceived poor medical care have not received any prior attention and probed. It's been over 2 years since his son died in his hands. But that chilling moment is still fresh on Ahmed Ali Zubaidu's mind. He said his son would have been alive if he had been given the needed attention by health officials at TTH.
He was down with something I suspected to be malaria. So I took him to one local hospital in Tamale here, what is the name? New Life. So he was admitted there for 2 days. And then later he was being discharged. So for the rest, about 2-3 days again, I realized that his condition is, he was having temperature. So I took him to one universal clinic. It was there we were transferred to Tamale Teaching Hospital. But upon arrival, Tamale Teaching Hospital was doing all that they can do. But I've realized that for about the second or third day, my boy was just, in fact, he was neglected. What I mean neglected is that you could see that there was not any serious or any known doctor that could attend to the boy. It was the nurses, the doctor, nurses, and other people who were attending to him. But we spent almost 3 weeks at the TTH. We couldn't even understand what the sickness is. The doctor was not telling me anything. All that I know is every day go and do lab tests. Every day go and do lab tests. And my brother, this lab test, I can never forget the amount that I spent in the lab test. Every day I was doing lab tests more than 3 times. And each was about 100 plus. I would just go and do this lab test. When I bring it, the doctor would just have a look at it like this and put it down and write. He said, go and do another one. He was not telling me anything. We spent 3 weeks, 5 days at TTH, only for the man in charge of that ward to come and tell me that, oh, my brother, I'm sorry, I didn't really have time to check on your boy. Actually, the sickness is not for this hospital. I said, what? For that long time, doctor, you couldn't even have time to look at my boy. Meanwhile, I was here with you day in, day out. And I don't know what to say. I told him, okay, fine. So what do we do? The most painful part of it is that he asked me, do you have money? I said, money for what? For transfer. I said, actually, I don't have money, but if you transfer me, I'll go. God is in control. And he went and wrote his things and other things for me, that I have to pay for an ambulance. I have to pay for the nurse who accompanied us to Kumasi. They made an agreement for us to go. But the most painful part of it is that after paying 700 Ghana cedis for the ambulance, on our way about some 3-4 kilometers from Tamale, and this ambulance got broken. So we were asked to come back to TTH to pick another ambulance, which was already available first, but they said they can't use it for us. I paid for that one too, 1,000 Ghana cedis. Paid the nurse, and then we were taken to Kumasi. And you would not believe it. For the 3 weeks that my boy was in TTH, any time that this boy urinate, you see blood inside. And yet they were not telling me anything. But when we got to Kumasi, things just got down. Everything was okay. But finally I lost the boy because they made me to know that the boy is already exhausted in Tamale. There was nothing they can do at Kumasi over there. I said, fine, I give everything to God. It's God who gives and it's God who has taken. But the reason why I am doing this is that TTH, we have a problem. Master, will you believe that it came to a time they gave me a description, this thing to go in for drugs. When I went, it was midnight, around 1:30 to 2 thereabout. The officer in charge of the pharmacy was there browsing with his phone whilst picking the drugs for me. After that, I went with the drugs and I checked the folder. Actually, I'm a little bit irritated. When I checked, I could see the grams that the doctor wrote for me and what the pharmacy gave to me. The pharmacy own is higher. I brought it back and I told my brother, the drug that you have given me, I'm suspecting it. The grams is too much for my small boy. He checked, he looked at it and said, oh, my brother, sorry. I was busy, that's why. So I asked him, if I would have given this to this boy, what would have happened? He said, oh, my brother, sorry. So there are innocent people dying at TTH. And it's because, one, they don't take time to look at the patients. Two, the pharmacies, the drugs that they are giving, some of them are expired. And some of them, the grams may be over or less than what the doctor is writing.
Many of such victims don't report such cases. He said before his 10-year-old son was transferred to the Konfanochi Teaching Hospital, he counted 42 drips that had been put on him. He hopes no parent goes through the experience his son had to go through.
I have been a victim. I have lost my boy. But, Master, I wouldn't wait for another person's life to just go like that. In fact, this is a boy I used to laugh too much. If you look at my boy photograph, you realize that among all my kids, he's the one who resembles me. But finally, he's no more.
How do you feel?
How do I feel is a big question. I feel very peeved. And anytime I set my eyes on the building of TTH, I got angry. Especially if I see a doctor walking with all his things and other things. Especially the ward that my boy was admitted. Anytime I got inside, I get angry. Because I could see my child was just thrown away.
Have you reported this to the hospital management?
Well, I don't know. Because when I came down, Master, from Kumasi, I just decided not to even see the hospital. Because which management are you going to report? Who? Because when you go to the hospital there, immediately you start narrating your story. Because I remember I met one doctor who happened to be my senior back at secondary school. When I started to complain, he said, look, that is how our hospital is. And you can't talk.
A baseline study by civil society groups Khaled and the League of Youth on unapproved charges for health services at the three major health facilities, Tamale Teaching Hospital, Tamale Central Hospital, and the Tamale West Hospital, found that patients generally held the view that most health workers are corrupt. Out of the 128 patients and caregivers interviewed, 89 claimed that there are corrupt practices in the health facilities. The survey found that corruption in health facilities is a reflection of structural challenges, administrative and supervisory weakness. Abu Inusa is president of the League of Youth. He speaks about the extent of abuse against pregnant women at the Tamale Teaching Hospital.
We've done a lot of programs. One of them was the community scorecard, which we have identified 9 communities. So we held a scorecard there. In fact, if you were there and listened to what people were complaining, you would have regretted for hearing what they are saying. In fact, the kind of abuse at the hospital is too much.
What are these abuses?
One of them is knocking pregnant women, slapping them. One woman even testified that he was about to deliver. So they just left her on the floor So it happened as if she was going to urinate. When she got to the urinal pit, one of the babies fell into the sink. That the nurses were saying, remove the child, remove the child. That she was in the process of moving, and they gave her another knock. And through that, another baby also fell down. I mean, the lady was giving birth to two twins. Another lady also complained that he brought the son to the hospital. I think they had some bruises. That when they came, nobody even spoke to her. That he was lying there for more than a day, until one of the cleaners came and told him, "Master, woman, is your husband around? And do you have money? If you have money, I'll call a doctor." According to that lady, that he gave the man 60 Ghana cedi. And by then, before he realized the daughter was on her, and they were attending to the child, that the daughter was calling other doctors to come and assist. I think the thing was too much. So they were calling other doctors. They even called the Cuban doctors to come around. Finally, the child passed on. So these are what we are saying. They are negligence. They don't care whoever is. And extortions too are also there. After the extortion, we'll be reporting it. And when we report, it seems the authorities are not doing anything.
If you say extortion, extortion is a broad word. What form of extortion?
And this could be when a woman goes to the hospital for CS, that the normal charge 400 Ghana cedi, especially TCH. And when you pay this 400 cedi, there will not be any receipt covering it. And when you demand of receipt, they will say no, they don't have a receipt for that. So that is the case that we are pursuing. Even this morning, when we were at the West Hospital, the deputy secretary is there. Because of that, he couldn't go to his work. One woman delivered, and they were saying he should pay 27 Ghana cedi. So the guy happened to be among the league of youth association. The guy said, no, we are not paying anything. Or we'll pay, then you give her the receipt. They say they don't give receipts here. Labor, the ward. Was it a labor ward? Yeah, it was a labor ward. That they don't give receipts. So we have to call the deputy administrator, who was far away. And I called the administrator too. Then he came there. Then finally, they referred them to the pharmacy to intervene. Finally, the money wasn't paid. But there was a skirmishes over there because they were exchanging insults and other things. So this is what is happening at the various hospitals.
Chief Executive of the hospital, Dr. David Akombela, says issues of medical negligence are serious and would not hesitate to probe such matters.
No, it hasn't come to my attention yet. But what we do is that we have all the departments have clinical meetings that they review, and we have mortality meetings where they review the deaths. And if there was an issue that needed management attention, they would have brought it up. But I think it's at the clinical level. We haven't had that report in this office.
When this issue is brought to your attention, is the hospital management willing to investigate such a matter because it's already at charge?
The issue about medical care and the astuteness to care is of concern to us. And if there's mention of something that may be suboptimal care of any sort, is investigated medically, even including inviting senior experts from other facilities to review along with us to establish whether the case was poorly managed on medical grounds or it was actually done according to the circumstances and the available resources.
The baseline study by Khaled and League of Youth also found that both petty and serious corrupt practices are engaged in by individual health workers and sometimes in connivance with other colleagues. The third level of rot, which they classified as grand corruption, is often done by two or more parties or group of people in authority. Extortion is just one problem. And there is another situation that threatens the quality of healthcare services provided by this hospital. Documents cited by JoyNews reveal widespread procurement breaches by hospital staff in the Tamale Teaching Hospital. A special audit by the internal audit of the hospital on drugs procurement above the ceiling of 29,000 cedis revealed that the amount was divided into two and awarded to one company, First Solve Limited, in 2014.
The Tamale Teaching Hospital is the only referral center in the northern region, Upper East, Upper West, and then upper part of Brown and Halfo. Right? The drugs in question were drugs that were not on the market. And normally we were grinding tablets, right, to put them in suspension form for patients. And that comes with a lot of risk. So when these medications, when this company came, they ciprofloxacin suspension. There was no ciprofloxacin suspension on the market at the time. Okay? And the quantity we needed was 1,000 for northern region, Upper East, Upper West, and northern part of Brown and Halfo, which was woefully inadequate. So if we put price quotation above the quantities, it's a teaching hospital. Okay? And 1,000 was not even adequate. And I am not a supply officer, I'm not a procurement officer. I just give them the quantities that are needed. I don't procure drugs. All I provide is technical advice to management.
In that same year, the hospital's audit found out that the anesthesia, ENT, ENE, OBS and Gynae, labor ward could not account for drugs costing 125,100 cedis because they didn't maintain a ledger. We
went into software, and all this information that they are saying is available in the software. I will show you samples of printings we did from the department. Okay.
In that same period, the audit pointed out that 107,920 cedis of drugs was unaccounted for. These drugs are rarely issued, but were always requested. The then head of pharmacy, Nicholas Ajimani, was in charge of the department.
In the hospital, there are certain drugs that, whether they use them or not, they must be available. There are some drugs for poison. If you overdose, right, they hardly receive those. We hardly use them. But at the tertiary facility where referrals come, from everywhere, those drugs must be made available. They may go and expire, but it must be available. So if the conditions don't come, you don't use them.
But why do you request for something that is not being used? Because the audit was clear that these drugs were rarely issued, but were always requested.
Rarely is what are the drugs? Rarely issued. See, before we even procure drugs, we get input from user facilities. All the doctors from the various departments provide information. There's a drug and therapeutic committee in the hospital. Okay? And input from all the user units come.
In a similar development, the store's manager overissued drugs amounting to 61,797 cedis. The same act was allegedly committed by the head of pharmacy and stores in a memo dated 2nd January 2014. He issued drugs worth 50,088 cedis without following due process.
In one of the strikes, around that, the doctors and pharmacists were on strike, right? And the Minister of Health at that time, Charity, right, indicated that the military installation to assist in provision of health care. The commander at the Bawa Barracks, Lieutenant Colonel Chum Ampufo, wrote a letter requesting for support so that he can take care of the people that would have gone to the hospitals which were not operating. Right? The instruction came from the Minister of Health that we should support the military, right, to take care of patients. So Lieutenant Colonel Chuma Bufo wrote a letter to the hospital. And I also wrote a letter to the Chief Executive. He approved. The letters are here. I can show you the letters. He approved. And we supplied the drugs and sent a bill to the Ministry of Health for reimbursement. You see, so I'm at a loss.
The head of pharmacy again, with then acting CEO, Dr. Prosper Akambon, on 2nd October 2013, awarded contract for drug supply without due process to the tune of 224,537 cedis.
Yeah, it's unfortunate. You know, I'm a pharmacist, right? I don't award contracts. What I do is to provide technical advice. Right? If you need medication, we budget, and then the budget is sent to the CEO, and then drugs are procured for the hospital. All I do as a director of pharmacy, right, is to provide technical advice. As a tertiary institution, right, that serve the Northern Region, Upper East, Upper West, and the upper part of the Brown Hafo, right? It is important that patients who come to the hospital are served with drugs that they want. A one-stop shop facility. And that is what I do as a farmer. I don't award contracts. No. I'm not even involved in the evaluation of medications. No. Mine is to get feedback from my units, and then I prepare a budget and present to procurement for procurement of drugs.
Some of these acts have been sanctioned, but others have not been resolved. Dr. David Akombela again.
Yeah, that was before I came. And then the first I heard of it was when interviews were conducted for promotions, and an officer's promotion was delayed because of such an event. So I think steps have been taken on that. And there are other investigations going on which may unearth other things around them.
I know this wasn't your time. I stand to be corrected. There was also an illegal collection of money for CT scan procedure and forgery of receipt by a senior radiographer, Alex Bugapi. What's the status on that issue?
Yeah, I remember when the issue was brought to my notice, I prefer dealing with systemic problems, not just individuals. So when it was brought up on an individual, we decided to put surveillance at the area to see how prevalent the case is. Is it recurrent, and is it widespread among the people there? So investigation is still ongoing. We are gathering information there, and in due course we would come up with measures to control that, and the culprits will actually be dealt with appropriately.
This issue was in November. If investigations are ongoing, I'm sure there have been some preliminary findings in terms of widespread recurrence. What has been those preliminary findings with regard to that?
Yeah, we've had situations where people were having difficulty getting their receipts on time and other things. But when we were following it, we realized that some of those cases which were done at odd hours, they were not able to pay, and some people had to come back later to collect their receipts and all that. And then there have been situations where people were, some particular case where somebody had asked a client to pay for contracts that was used, and all that is captured. And like I'm saying, very soon we're going to sit on all that and deal with the individuals involved in it.
This contract issue, was it unilaterally done per your findings?
Yeah, it was just one person that somebody had come in, needed the contrast, it wasn't used, and later on another person came in and they used it for that person, wanted to collect money from that. Actually, that money was refunded, but once he's attempted to do that, it means that he was coming to cheat, and that's also inside the investigations to be done.
In 2014, there were some procurement breaches with regard to purchase of drug, issuance of drugs. We've cited a number. I know this wasn't under your tenure, but what has been done about these things to ensure that they do not reoccur?
Yeah, procurement breaches are serious matters because there are situations that, if not checked, it can actually run down any system, and that's why we are so much interested in all that. Even though I wasn't there at the time, it's of interest to us, and we review all those cases. But looking back on it, realized that the then board had gone into it. The ARIC, the Audit Response Implementation Committee, had actually sat on it, and they've resolved so many of the issues. The various areas were corrected, officers were reprimanded, and various levels of sanctions were meted out. So that I can confirm that. The document is even here.
Okay. In the case of the one where procurement of drug, which was above the ceiling of 29,000, and it was even awarded to one company, what was the sanction against this person who was in charge?
I think what happened in that instance was that they established that the officers did not refer appropriately to the public finance administration laws and all that. So they were asked to make sure they go by all those things at all times, and the matter was referred to the main board. There was a committee that sat on it, the ARI committee, and it was referred to the main board to take steps on the director. Once he was a director, the board had taken some steps on that.
I think people will be interested in what the steps were.
I'm not privy to it now because I'm not too clear what they did, but they said the officers should be reprimanded.
There was also this issue where drugs costing 125,000 was given out, but ledgers weren't maintained, and it was recommended that the recipient account for these drugs. Has it been done?
Yeah, when the ARI committee sat on it, they charged on the director of pharmacy at the time to go through to make sure that this was rectified. They identified the officers, and they actually realized it was through poor communication and poor records keeping, and all those were rectified and evidence shown to the board.
There are still a few issues. Same period, the store's manager overissued drugs amounting to 61,000. Has he been made to account for it?
He overissued, so they were able to trace to see where the drugs actually ended up. It ended up in the hospital here. So what they did was to follow and reissue those ones for use in the facility. So the hospital did not actually lose it. But when that happens, if they hadn't detected and to follow it in a timely manner, the hospital could have lost. So the officer, that particular officer too, was sanctioned. I think he was reassigned at a lower level, and there was some level of demotion that they meted out to him at the time.
There were also drugs that were purchased but never used around that same time.
Yeah, what happened, because it was a newly established teaching hospital, a lot of specialists were coming and going. And specialists would come in and then request for certain drugs to be stocked, because that is what he uses to manage cases. And within a short period, he relocates somewhere or he moves out, and then the other specialists don't use that. So the advice was taken that when they are doing such procurement, they should be careful about the quantities they would do, because if you were to be procuring drugs that will be used by some particular type of specialist whose period of stay here is not prolonged, then we may be losing such drugs, because it will not be used by the other specialists. So that has been rectified, and we don't have that situation now.
One last case on those contracts. There was an award of contract for drugs without due process around the tune of over 200,000 by then head of pharmacy and the acting CEO then, Dr. Prosper Akambo. What's the update on that case?
Yeah, I've looked through the ARIC committee and what they did about it. They actually realized that the then CEO had traveled and he handed over to the director of pharmacy to act as chief executive. So when they were doing the procurement at the time, the director of pharmacy, signed. And then when the auditors were reviewing it, they thought the director of pharmacy shouldn't have been in a position to issue the contract, particularly in the area of drugs. There would have been something like some kind of conflict there. So they advised that all those contracts should be retrieved, reviewed, and if the CEO has come back, he should review them and see if it's appropriate, then he should sign. They were reviewed, they accepted that the only breach there was the director of pharmacy signing, so they were re-signed.
Unresolved, unpunished cases have the tendency to embolden current staff to engage in all forms of malfeasance. The effect is that the hospital becomes financially drained and ultimately services suffer. For Hotline documentary, this has been Kwete Nata.